Welcome to Marney Reid Presents Connect to Develop, where we provide insight from healthcare leaders on the hottest topics and trends. Mission and purpose. I talk to a lot of healthcare leaders who say the best thing they did for their company was to be intentional on defining their mission, and they've built their company around that purpose. So what does being mission-driven mean to you?
I think when I look back at when we started our company, there was a lot of outside pressure from the DOJ. It's when AdvaMed was started. 2006 to 2009 is really when we were changing how orthopedics was run. And with that pressure from the DOJ to limit, events and different opportunities, it became increasingly difficult to procure implants for different mission trips. So my dad and Dr. Dorr had been working with a company to create a line of implants that would be high quality and could be used anywhere in the world. So throughout the US and then on mission trips as well. It was a spine company. They actually decided that was not within their model and their strategy and where they wanted to go. So they had a board meeting and they said, you know what, we're not going to go in that direction. And they actually fired both of them from the board of directors of a company that they had helped to found. So it's a great story. They went downstairs to Current Concepts. They were sitting at the lobby at this, very well-known orthopedic conference, and they popped a bottle of champagne and said, let's do this on our own. And I had actually just graduated from business school, and I got a call that said, hey, I know you don't love what you're doing right now. Why don't you come help us? And I said, okay, number one, absolutely not. And then I thought about it some more and I kind of got talked into it. And we had a lot of fun. And that was the start of Total Joint Orthopedics, was this mission to have streamlined instrumentation that can go anywhere in the world, implants that are high quality, that have exceptional patient outcomes, and then can be used on the side for some of this mission work. So it was really integrating a mission into the company. And I think that's so important. That's how I was raised by my parents, to always give back. And that's how my formal education at Vanderbilt really focused on the concept of corporate social responsibility, where, yes, you are earning a profit. You are absolutely, bringing in a return for your shareholders. You are taking care of your employees. But how are you improving the world around you at the same time? Are you taking care of the environment? Are you, creating professional development for your employees? Are you making the world a better place in addition to making money? And so that was really the start of TJO and where we wanted to go. And we've always kept that in mind, for the last 15 years. And so that's a part of who we are. And I think that helps us on so many levels know who we are at our core and where we want to go.
So health equity, can you walk us through this concept for those who may not be familiar with it and how this applies to MedTech, whether it's not-for-profit, whether it's a for-profit company? I love the concept of social responsibility, but you really emphasized in an earlier conversation with me about health equity and how it's a core root of even just you as an individual.
Absolutely. I think, at least my definition of health equity is that everyone deserves exceptional health care, regardless of, their ability to pay, their payer status, their facility, where they live. Are they rural? Are they urban? Everyone deserves access to that care. And so when you think about, a lot of people are talking about value-based healthcare right now. And to me, I feel like some people may interpret that as, well, it's discounted or there are corners cut. We really believe that everyone deserves exceptional healthcare, whether that's the materials, the implants and instrumentation that's being used, your surgeon. How can we improve healthcare as a whole? And we all know that it's getting more expensive. All know there's pricing pressure from every direction, whether that's reimbursement, whether that's the implant costs from the company. How do we become more efficient so that we don't need to make choices? You don't need to, as a surgeon, does the surgeon need to tell someone, I'm sorry, you can't have this product because it's outside of your, payer's restrictions?
Do you think being a smaller company that doesn't report, let's just be honest, to shareholders, can be more nimble in value-based care and can apply, maybe not in so many dollars, right? Because instead of, a 10B company, it's, maybe, closer to a 1B. Is it easier to be more nimble in value-based care? And is it easier to uphold the corporate social responsibility mantra when you are a smaller company?
Yes and no. I think it probably depends on, who your corporate governance is and who your investors are. We certainly have investors. We don't have to report as many things to the SEC, but I think we probably have the same pressures. Shareholders have invested money and they want to see a return. But I think it can be both. I think you can provide value-based care. I think you can provide exceptional products with the idea that you're going to make a better environment for the hospitals, for the patients, for the surgeons. I mean, you look at this transition to ASCs, and that's really what's coming out of that is a lot of the surgeon ownership is saying, look, we're going to do things better. We're going to be a little more efficient. And we're actually going to make the same amount of money, maybe more, because we can be efficient. We can do 10 surgeries in a day or 6 instead of 2 or 3. And so there is the potential to be more creative, to be efficient, and to actually probably provide a greater return for your shareholders. And I think that holds regardless of your size.
That makes sense. So tell us about Operation Walk, the purpose and mission for this non-for-profit, and why the co-founders, Dr. Erin Hofmann and the late Dr. Larry Dorr, were so passionate about its work.
Yeah, Operation Walk is such a great organization, and we work with a few organizations. We work on, with several surgeons on one-off opportunities, with certain patients around the country. We've worked with Operation Walk USA. We've partnered with Indus Hospital in Pakistan to help with a few missions there. Operation Walk happens to be our core because, of course, the late Dr. Dorr founded Operation Walk in 1996. My dad became a part of the organization in 2006 and created his own chapter. And I've traveled, I think I've done 10 or 11 missions now with Operation Walk Utah, Operation Walk LA, and then the London, Ontario group that was founded by Cease Rorabeck. I've been to Guatemala a few times with that crew. And it's such an exceptional experience. It's really, as someone who's been near medical care my entire life, but I'm not actually a doctor, it's the closest I think I will get to that feeling of seeing a person healed. Because, as industry, even as a sales rep, you go in and you get to see that patient, you see their leg draped. You may not hear the story behind, what this joint replacement is doing to improve their life. And you go, to this other setting where there's no bureaucracy, there's no insurance company that you're fighting with. Of course, everything has the same rules. It's like picking up an OR and taking it down there. So you still have all of the same health and safety rules during the surgery, but you get to see the patients and you get to hear the stories. And for me, that's absolutely life-changing to see the impact that this care gives to someone else. I got into an argument a long time ago with someone who said, I don't think Medicare should pay for joint replacement because my mother doesn't need to go and ski at Deer Valley in the winter on the government's dime. And so that's the side I think a lot of people see of joint replacement, that it's elective, that it's just like plastic surgery. But what you get to see is the story behind the people and how it's changing their life. So the very first patient who received TJO hips, he had bilateral hips. I still remember the day like it was yesterday. His x-rays are sitting behind my desk right now. He was 33 years old. He had fused hips from the time he was a child. And so he had to go home every night. He couldn't work. His family would have to tip him into bed and stand him back up. He couldn't tie his shoes. He couldn't dress himself. And he had bilateral hip replacements. Dr. Dorr was there. My dad was there. We did the very first TJO hips. And he stood up and he walked the same day on crutches. Obviously, his muscles were very, very weak. He had no hip flexors, but he walked and then he started crying. And then we all started crying. So these are stories of you're changing people's lives and the way that they're able to walk and move and be productive in society. And it's just indescribable until you actually experience it. It's miracle work. We are so lucky to get to work with surgeons who, can make these life-changing impact on people's, their whole outlook.
I worked for an industry leader in medical devices, at the start of my career in medical. And at the time, the CEO put a huge emphasis on helping the underserved. And his stance was, when you assist the patients in the most challenging tier of care needs, to your point that you just made, it impacts so much more than even just pathology. So what's your stance on this? And out of the 10 to 11 trips you've been, in the US as well as overseas on Operation Walk, can you talk to me about, that was one individual whose hips were fused, and now, with physical therapy and, post rehabilitation, he hopefully will be able to contribute to, his family. Talk to me about the ripple effect that, Operation Walk, you go down and you do, a couple hundred surgeries. Tell me what that means to the communities of those patients.
Yeah, I mean, I think it certainly has a huge impact on the community, whether it's in, Central America or any of the other amazing locations. I think there are 21 chapters of OpWalk now, along with all the other organizations that are similar. There's, Dr. Parsley's group out of Houston. There are, this is taking on. It's catching on. It's a trend. And I love that. I love that, more people are getting involved. More people are really dedicated to this cause. I think it is so life-changing. And it also feels like it's just a drop in the bucket. When I've gone to Guatemala with those teams, yes, you see 100 patients or you see 55 patients done. And there's another group coming in 2 weeks. And you do see, we have seen changes over the years where patients are coming in and they're not quite as dire as they were, 15 years ago when I did my first trip. Is that because we're actually helping people become more productive in the community? Is it just because, we're more urban, more people have heard about us and we're getting a different level of patients coming in because there's not adequate healthcare, as we lose the middle class in this country or in other countries. I'm not sure what that looks like from a data-driven perspective, but, I think when we have just seen patients individually, they come back and they see us and they talk about, I never thought I would have a family. I just thought I would be a burden to my own family. I would be an outcast in my town. And now, look, I have a job. I have a family of my own. I can participate in society. And it's such a huge difference where you have, there are so many studies on depression, on cardiovascular health, on pulmonary health. So we're creating healthier people with something as simple as a joint replacement. And over time, I would hope that takes some of the burden off of our healthcare system.
I can't imagine it wouldn't. I recently did an interview with the CEO of OREF that funds, all the musculoskeletal research, and he shared in depth, the ripple effect of other, health conditions and comorbidities that can be impacted if you don't address, musculoskeletal care. So it makes total sense. With population health being so big on advocacy and so many of our leaders at the major societies, going to Capitol Hill and really pushing for so many different things, how do mission-driven companies such as yours and others get involved in these advocacy efforts? Or are you involved at all?
We're not. I think there are some different groups we participate in with some of the standards for quality, some of the behind the scenes work for the FDA, things of that nature. I love that our industry groups are now going to Capitol Hill. I think when you look at the number of MDs that are actually in the Senate, in the House, it's usually around one, maybe two people out of, several hundred. Mm-hmm. So I think it's really fighting an uphill battle. And I think that the time that's spent on the Hill, I think those surgeons are doing such an incredible job really trying to make it known what orthopedics does, as an industry.
So staying on this value-based care thread, what, if anything, is at risk if the focus from the payers is on cost containment and reimbursement reduction for physicians and health systems, which ultimately forces companies to reduce prices? Will mission-based companies trying to use some of their profits to help improve healthcare in the underserved areas even be able to continue this work?
Yeah, I think so. I think that's where, this concept of efficiency comes in. And I know I've said that quite a few times on this on our conversation already. I say it a lot in my daily life as well. We can all cry and stomp our feet and say that, we're upset that the hospitals are pushing us to lower pricing. We have to get to lower pricing. We have to figure out a way in our manufacturing to push our suppliers to come up with, more modern manufacturing, to use technology. We have to use technology ourselves. And so that's how we reduce our costs, because we've got to adapt to this pricing pressure. At some point, of course, there will be, there's a hard line that we can't make implants for free, obviously, but how can we reduce some of these costs? And so I think that's what I spend a lot of my time thinking about is, how do we solve the needs of our customers? Not only how can we make something that's really cool, but also, is this solving a real world problem? So we spent a lot of time talking about that. And that's as simple as, when we started and we wanted to make sure that we had implants and instruments that could travel for Operation Walk. So that was, a requirement that was built into the product line that, as it turns out, is amazing for the rest of the world. So we have one tray of instruments because you've got to be able to travel. You've got to be conscientious of your shipping costs. Our instrumentation is all super intuitive. And that has played out very well in a world where, a lot of the nursing staff, the OR staff, they're travelers. And so they haven't, seen that surgeon's workflow. They may not have seen orthopedics before. And so do we create instruments that are really intuitive for someone who is not your everyday team? And so when we look at, our packaging is small because in Europe, you've got to pack in and out everything you bring in with you, you've got to haul it out as well. Our instrumentation is color coded. So things that are moving are turquoise. We have a key in the instrumentation of, if it's moving, it's turquoise. If it adjusts, it's got a certain knurling on it. So there are different ways I think that we can help hospitals, even though they're little tiny ways. How can we solve real world problems? And, that's going to lead to better outcomes. That's going to lead to better care. And it's going to lead to a better day for everyone who is involved in that episode of care. And I think what I'm most excited about is to see, for instance, AI. Where's that going to take us? How can that help us do our job better? How can that help us reduce our costs so then we can continue to provide the same level of care, again, regardless of the facility, regardless of payer status, regardless if it's, a paid case here in the US or something that we're helping to support out of the country.
I love the color-coded concept. And if I was a scrub tech or a traveling nurse, I would be hugging that rep after I, broke scrub on that. And I, in fact, also color code things. In fact, my podcast spreadsheet is color-coded. Who needs a script still, whose interview is coming up, who I've sent the notes back to my, editor and everything. So I think that is incredible. And yeah, it's funny. It was like, through solving the need of getting everything in and out for these amazing mission trips, you prepared for value-based care without even realizing it. So that's awesome. I love that.
Yeah, absolutely. And that was, for me, that was so much fun to see that proofed out. Because the first trip we took our one trays to, we said, okay, we've got to be able to get this concept down to one tray. We can't have pre-op imaging. We can't have disposables. We've got to have everything you need. We can't have shortcuts in the surgeon workflow. How are we going to do this? And so our product development team is amazing. We worked with an awesome group of surgeons to help us do this. And then the very first trip we went on, you're not in a huge academic center where, hey, if it doesn't work, call in the backup and we'll figure it out. There's a patient on the table and this stuff has to work for that patient and it's going to work. And so that was one of the best days ever, was being able to actually have it work and having that play out in an OR with surgeons who had never used our products before and who had no idea that this was, the pressure was on everybody, but them, they had no idea. So it's been a really fun process. So there's a surgeon out of Sydney, Australia, Bill Walter, who is one of the smartest people you'll ever meet. And he has worked on his own startups. He has created several cool products and technology that are available. But he taught me this concept of Jugad, which is an Indian concept that creativity is born from necessity. And so that is really, do you have the pressure cooker that you can create, and you can create a solution when you have to? And to me, that's what's so cool about our industry is, how do we make improvements? Oh, we're going to an ASC. We want to try and do this apart from the hospital. How do we make sure that we have everything we need and the patient is fully taken care of and may actually get a little better result, by coming to this center where it's focused solely on the procedure that they're going to have. So I think there's so many cool things coming. Like I said, I'm really excited to see what AI is going to do for us. Some of these other technologies, whether it's, robotics or augmented reality or material developments. I just think that there are a lot of cool things coming in orthopedics.
So not to be, a complete spoiler alert, but on that thread, is that what's next for you and for Total Joint Orthopedics?
I think there are a lot of great up and coming companies and a lot of great up and coming technologies. And, we've had amazing partners. That's one of the things that we've been able to do is partner with cool companies that have technologies that can complement us. So who knows?
Well, I look forward to seeing the posts on LinkedIn and seeing you at AUKUS coming up in November. Thank you again. What an honor to speak with you today, Erin. And if the listeners would like to learn more about Erin Hofmann and about Total Joint Orthopedics or Operation Walk, please check out her bio in the show notes.
Thanks for having me, Marnie.
Thanks for listening to Connect to Develop. You can find more interviews and Marnie's Minutes on my YouTube channel at Marney Reid Presents.